Before watching this video, I just want to make sure that everyone knows that this video in no means am I trying to bash all doctors as a whole, and I'm not trying to recommend that you don't see doctors. I think it's very important to visit a doctor if you're feeling ill or if you feel like anything is wrong with you at all, and it's important to take care of yourself. This video is just talking about a select few doctors. In 1986, when sociologist Sue Fisher was observing a hospital, she was surprised by the large number of hysterectomies, the large number of recommended hysterectomies that were occurring in the hospital. When she talked to the doctors and asked them why it is that way in that hospital, the male doctors replied that these organs are unnecessary after the childbirthing years, so why not remove them? In 2007, a statistic on hysterectomy showed that 3 out of 4 of the surgeries were inappropriate. Some believe that the reason for the high numbers of the hysterectomies is spurred on actually by greed from the doctors. In an interview in 1994, one resident explained to the sociologist Diana Scully, he explained how some of the doctors are persuading the women to go under the knife. The word resident here is used for people who do not know. It refers to doctors who have just graduated from med school. They have to go through, after the medical school, they have to go through residency at hospitals or any other medical building. The words of the resident are, "You have to sometimes convince the patient that she is really sick and that she is better off with a surgical procedure. To convince a woman to have this surgery, the doctor puts on a serious face and tells her that the examination has turned up fibroids and they might turn into cancer. This statement is often sufficient, for it frightens women who picture themselves dying from cancer. To clinch the sale, the surgeon withholds the rest of the truth, that fibroids are common and that they most likely will not turn into cancer, and that the patient has several non-surgical alternatives." My personal view on the subject is, I understand that both men and women have their bits removed to avoid unexpected pregnancies. My father and my uncle both went through that, and for my boyfriend, his cousin just went through a hysterectomy after giving birth to her last child. But when it comes down to making the decision whether to do it or not, it's really up to you, and that's the most important thing. Just base your decision upon your personal beliefs and feelings. Don't let your significant other, family members, or anyone else in your life try and persuade you to do one thing or the other. It's your body. You're in charge of it, and you have the right to make the decision. I do recommend, though, that you talk to your significant other, because it kind of affects him or her, if you're gonna have any more kids or not. And I think that you should just express your feelings, and just communication is key before going through a major surgery like that. And just don't let anyone pressure you into doing something that you're not too crazy about it. If you're not sure about it, wait. That's the most important thing. Don't just do it, and then you might end up regretting it later, whatever you decide to do. What I want people to do before they go into surgery is just do research. It's so important. Not all doctors are bad, but still, it might ease worry before going into surgery, and you might know how to take care of yourself better after going into surgery, and know how your medication is affecting you, because sometimes doctors forget to tell you, oh, you shouldn't go out in the sunlight if you're taking this kind of medicine, or just know everything also that the medicine is doing, that how it affects your body, how it affects your brain, how it affects your liver, and it's just really important to become aware of what you're putting into your body. You're on it, and if you're for your sake and for your wallet's sake, just do your research, know your body, and if you have any questions, ask your doctor. For major surgeries, I recommend getting a second or a third option. I'm not saying that all doctors are bad. There's just one or two or three. Just be careful, and like anything else in life, there's some people you can trust and there's some people you can't. And some people have really good intentions, and some doctors are so nice and they're just there to help you and to make things easier for you. But then there's some doctors that aren't. Just rely on your beliefs before you make a decision to go under the knife.